Let's start by talking about mucus, also known as phlegm, sputum or secretions. Mucus is actually a natural substance that helps to clear foreign particles and bacteria from our lungs. It brings it back out of the airways and serves to protect our lungs. However, excess mucus can be a problem, and when we have excess mucus, it's usually preferable to cough it out. However, this can be challenging as it often gets a bit stuck. So if you're struggling with excess mucus, the first thing to do is to make sure you are hydrated. Dehydration dries out the mucus and makes it more sticky and stubborn to shift from the airways. It's as simple as drinking a non-alcoholic and ideally non-caffeinated beverage like water, but warm herbal teas can often feel more relieving. To help hydrate your airways, try this simple home saline solution. Dissolve 1 teaspoon of salt in hot water, cool the water, and then gargle the salt solution for a few seconds. Salt water pulls water into the airways and thins the mucus, making it easier to clear your lungs. Just remember to only gargle the saline solution and not to swallow the salt water. When mucus comes up our airways, it actually goes to the back of the throat, and we typically swallow most of the mucus that we produce on a daily basis. Don't worry, it's not going back down into the lungs as it comes up the airways and then goes down into the digestive system. However, when we produce excess mucus, it's usually preferable to cough it up. However, this can be tricky because the mucus can often get a bit stuck in the airways. To help get moisture further into the airways, you could breathe some salty sea air, have a salty steam bath, or make yourself a home nebulizer with a bowl of hot water, some salt, and perhaps some drops of menthol or eucalyptus oils. You can capture more steam by putting a towel over your head. Did you know that your nose naturally moisturizes and filters the air as you breathe in? So it's always best to breathe through your nose during relaxed breathing. If your nose is blocked, consider trying this saline rinse method. Have some tissues to hand, make sure your hands are clean, then pour some of your homemade solution into the palm of your hand. Bring the solution up to your nostril, tilt your head, block the other nostril and snort up the solution. Then blow your nose. Repeat on the other side. Some of the solution may get into the back of your throat. This is not harmful and will have a negligible impact on your overall salt intake. A better way to perform this rinse technique is to use a sinus rinse kit as shown on the screen here. Next, let's review some of the common herbs used for coughs and breathing issues. As a licensed healthcare professional, it's difficult for me to recommend herbs due to the lack of scientific evidence supporting their use. However, here are the top 5 herbs that are commonly used for people with colds, sniffles and breathing issues. Eucalyptus, peppermint, thyme, licorice root and menthol. Menthol is actually synthetically created from oils, including peppermint oil. These herbs may work via a range of mechanisms which include breaking down and thinning mucus, soothing the airways, reducing inflammation and providing immune support. Excess mucus in the throat can also be caused by food intolerances. Common culprits include wheat, gluten, dairy and even eggs. If you temporarily stop any of these food types, you can assess the change in your mucus production. This is called an elimination diet and is cheaper and more certain than food intolerance tests. You should also pay attention to the air around you. If you're breathing in smoke, even from other people's cigarettes, it can inhibit your mucociliary escalator, which then leaves mucus trapped and building up in your airways and lungs. This can even occur with vaping, due to the chemicals in vapes getting down into your airways. Now, if you're suffering with a cough or feel like you've got some stuck mucus, these next 2 techniques will really help to shift that stubborn phlegm. This is how to huff to help you clear your lungs and airways and get control of your cough. Firstly, get control of your breathing with 3 slow, deep breaths. Focus your breathing pattern on abdominal expansion and avoid upper chest expansion. Next, take a half breath in and then force the air out of your lungs through your mouth and exhale for as long as possible. Try this 1 to 3 times and try to avoid coughing during this stage. After 1 to 3 huffs, you may find your secretions have shifted
and can be coughed up more easily. If the Huff technique has worked, hopefully your cough will be more productive and will need to be less forceful and hopefully less aggravating. So you can do the Huff technique regularly as a cough management strategy, but stop doing it or reduce the frequency if you feel lightheaded or dizzy. This can often occur if you overbreathe or have taken too many deep breaths.
One of the most well-used mucus clearance techniques is the 3-phase active cycle of breathing technique. Let's have a look at how to do it. Number 1, take 5 relaxed breaths, slowly breathing in through your nose and out through pursed lips to create a bit of positive pressure, which helps with your exhalation. You should feel your abdomen rise during inhalation, while the chest remains relaxed. The next phase is the thoracic expansion exercises. Hold around your lower ribs so you can feel them expand with a long inhalation, again through your nose, followed by a long exhalation out of the mouth. And repeat this thoracic expansion exercise up to 5 times. The next phase is the forced expiratory technique. Take a full breath in through the nose and then force the air out through your mouth to create a huffing action. You can also vary the technique by taking a long breath in followed by a half huff out. Or take a shorter breath in followed by a long huff out. During or after the active cycle of breathing technique, you should find it easier to cough up your trapped mucus. Prepare for the technique by moistening your throat with a drink of warm water, blowing your nose and sitting upright. Place your hands over your chest and upper abdomen. Make sure that your upper abdomen rises and falls with your breathing rather than your chest. This indicates that you're using your diaphragm, which is your main breathing muscle. To perform the technique, take a normal breath in, followed by a prolonged breath out, exhaling as far as possible and resisting any urge to cough. If you can breathe in through your nose, it will moisten the air, and if you do have a cough, reduce the chances of triggering it. Once you've breathed out as far as possible, take a small breath in and then breathe out again as far as possible, repeating 2 to 3 times. During this procedure, you may hear your lungs rattle a little bit, which is a sign that you are loosening the secretions and that the technique is working. To progress, take a larger breath in, aiming for a mid-range breath, followed by small breaths out. Repeat 2 to 3 times. Finally, take a full breath in, followed by small breaths out, 2 to 3 times. You should now be ready to clear some secretions or mucus with a cough, or better still, with a huff cough. Today we're going to talk about an easy and inexpensive solution for mucus in the respiratory system: salt therapy. Salt is a mineral composed primarily of sodium chloride, and it can come in different sizes and shapes with different trace elements that may influence the flavour and cost. But essentially, salt is sodium chloride. Salt therapy has been used for hundreds of years as a simple and effective solution for managing respiratory conditions, including sinus congestion, sore throat, and mucus problems. Salt has antimicrobial properties that can combat various pathogens, making it a powerful natural remedy. When it comes to mucus, salt attracts water into the airways, which thins the mucus and makes it easier to cough out. Inhaling sea air, gargling with warm salt water, taking a salt bath, or creating a mini steam bath are all easy ways to benefit from the power of salt therapy. For people with chronic lung diseases, a nebulizer is often prescribed. This device uses a water solution called hypertonic saline, which is a concentrated salt solution that helps to clear mucus from the airways. So if you're struggling with mucus in the respiratory system, consider trying salt therapy as a natural and effective solution. Don't forget to consult with your doctor if you have any concerns. Mucus lubricates, filters and protects the lungs by trapping allergens and viruses before they enter the lungs. But you can have too much mucus. It can accumulate in your throat and airways and be uncomfortable, causing a constant cough and throat clearing. In this video, I will share some advice, but speak with your GP or pharmacist before starting or trying any of the techniques recommended in this video. Some of the most common causes of excess mucus production are a post-nasal drip. This occurs when drainage from the nose travels down and accumulates in the back of the throat. Reflux. This occurs when stomach acid moves upwards into your throat. Food allergies and intolerances. Having an allergy or intolerance to certain foods can trigger excess mucus production. Dairy, wheat and gluten are the most common triggers. Short-lasting infections like the common cold or other respiratory infections often increase mucus production. And chronic conditions, such as chronic bronchitis, can also cause mucus overproduction. Visit your doctor if you believe you may be suffering from any of the conditions we've just mentioned. Addressing the underlying cause of excessive mucus production is the most important thing to do. In this video, we're going to show you how you can use a mucus clearance device to help clear your airways. Now, our preferred go-to product is the one we're using here. It's the AirPhysio mucus clearance device. This is not a product placement video, but we have an affiliate Amazon link in the product description below, but we haven't been paid to do this video by the AirPhysio company. This is just our preferred advice, and we're going to show you how you can use this successfully to help clear your airways. The AirPhysio has two features that help you clear mucus from your airways. Let's have a look at what they are and how they can be useful. The first thing the device does is slow down the air as you breathe out, and it achieves this by making the air pass through the small tubes and the small air vents on the top of the device. This creates the positive expiratory pressure, often abbreviated to PEP or PEP. This increase in pressure keeps your airways open, rather like putting air in a balloon. Let me show you. Restricting the outflow helps to splint the airways. So if you imagine the balloon was your lungs and the tube of the balloon here is your airway, if I don't splint the airway and just let go, you'll notice that the end of the balloon wobbles, which is what can happen to your airways sometimes when you try and exhale too quickly. Now watch what happens when I splint the end of the balloon. The neck of the balloon there will maintain its shape. And that's how positive pressure works when we're breathing. By pursing our lips, by restricting the airflow using a device, we can usually exhale easier because our airways are not loose and floppy. So that's how positive expiratory pressure works. The second smart feature is this ball bearing, which moves up and down rapidly to oscillate the positive expiratory pressure, creating small but rapid pressure changes which create a vibration through your airways and chest. This vibration can help to loosen stuck mucus. Let's have a look at the best way to use the device. Firstly, make sure you're hydrated and then sitting comfortably. And have some tissues ready if you're going to cough up some sputum. Slowly inhale through your nose and hold your breath for 3 seconds. Seal your lips around the device and breathe out so the air passes through the device. Two things will determine how effective this device is for you. Number one, you need to exhale with the correct amount of force. Not enough, and the ball bearing will not cause the oscillation. It will not flutter up and down. And with too much force, this will cause the ball bearing to rise up continually and again not oscillate or flutter. So you need to exhale with the correct amount of force, and that can sometimes take some skill or some working up to if you have some weakness in your lungs that's preventing you from exhaling as hard as you would like to. The angle of the device also makes a difference. Not enough, and the ball bearing will not hover over the hole. And if the device is too vertical, we've also found that the oscillation is also reduced. We found that the best angle is about 45 degrees, and you'll notice that the angle of the neck of the device is designed such that it usually puts the device at about 45 degrees if you have the neck of the device on the horizontal plane. It's recommended that you use the device for 5 to 10 minutes, 1 to 3 times per day. Because the use of the device requires you to breathe more or deeper than usual, it can cause you to feel lightheaded due to the reduction in carbon dioxide in your bloodstream. This is not generally dangerous, but it should cause you to stop or normalize your breathing until your lightheadedness stops. At any point during the use of the physio device, if you feel an increased need to cough, then stop using the device and see if you can cough up any previously stuck mucus. You may also be able to try some manual therapy in the form of percussion, but doing these techniques should be under the guidance of a medical practitioner or respiratory physiotherapist, for example. Now, a percussion technique looks like this. We take a towel to place over the patient to absorb the force when we're performing the percussion. The percussion that you do is going to shake the rib cage and therefore also provide some movement and shaking to the airways as well, which can help to loosen the secretions. So starting over the lower ribs, which will be over the lower lungs, we can then move up to the middle of the thorax, which would be the middle part of the lung, and then also the upper as well. And following this, it would be a good idea to sit the patient up and see if that's loosened off some of the secretions by asking them to either do the Huff Cough or to see if they want to do a standard cough to try and cough up some secretions. It's also possible to perform the percussion with some forced expiratory flow. Once again, percussion is usually done by a respiratory nurse or physiotherapists, and it is often taught for patients or their family or carers to do as well. So it is possible for you to do percussion, but it is advised that you get some advice before trying it. Anyway, I hope this element of the video was helpful. Should you be advised to try some percussion, hopefully it will be useful for you. As you can see, it's quite simple to do, and the advice is to use a towel with a few layers in order to absorb the force, and combining it with that forced expiratory flow can really help to loosen the secretions. We've also been experimenting with a percussion gun to see if this can be used for respiratory percussion, and this is what we found. On a low speed and with sufficient dampening, it's possible to comfortably use a percussion gun for respiratory percussion. And what we did was combine it with deep breathing and some huff coughing as well. Changing the position of the percussion gun to target different areas of the lung. We also tried combining the percussion gun with the oscillating positive expiratory device. So the combination of percussion from the mechanical gun and the oscillating pressure causing a vibration through the airways was useful for trying to clear secretions. But our preferred method was to use the percussion gun in combination with a Huff Cough method. We also experimented with the idea of self-percussion, which of course is going to be much easier to do using the mechanical device, as it generally requires less skill than trying to do percussion on yourself. So here Richard is doing a forced expiratory flow, a Huff Cough, and using the device, importantly using a cushion to dampen the percussion from the device. So this is an example of experimenting with self-percussion to help clear your secretions. Once again, doing percussion is usually done by a medical professional or advised by a medical professional or a respiratory nurse or physiotherapist, for example. But if you have been advised to do percussion and you don't have somebody available to do it for you, and you do find it's a helpful technique, then it may be possible to use a percussion gun plus some dampening in combination with a Huff Cough to help clear your secretions. Stop if you feel lightheaded, stop if you feel any pain, and make sure you report to a medical professional if you've had a cough for more than 2 weeks. Our airways are lined with delicate cells that have little hair-like projections called cilia. Cilia constantly shift debris and excess mucus out of our airways. This impressive natural clearance and defense mechanism is called the Mucociliary Escalator. So remember, stay hydrated to help shift the mucus up the escalator. The next bit of advice is to stop smoking and also avoid vaping and inhaling any other chemicals which may irritate your airways. The chemicals from vaping and especially smoking can cause the cilia to become paralysed, which is a bit like switching off the escalator. Poor air quality can also be a contributor, so make sure you avoid these things and try to breathe clean air. The colour of your expectorated sputum, that's what your coughed up mucus is called, is also a sign of a potential cause. Green or yellow mucus is a sign of an infection, and orange, rusty brown or dark red sputum should be investigated by your medical physician or your GP. Subscribe to the channel, we've got lots of other helpful videos on there and more on the way. Thanks for watching, hope you found it helpful. See you in the next video.